Hello, everyone. Good evening. Once again, it is such a great privilege to be in your home, and we welcome you to this platform, Pastor Sarah Batroni, Thursday Night Live. It's a great privilege to be once again with you for another great discussion with one of our guests. Today's discussion is going to go around a very important, very serious topic, COVID-19 and frontline health workers. As you know, a lot of the healthcare workers have also been affected by COVID-19 as they take care of the patients. Some of them have gotten so sick that they were not able to work for a few weeks. Some of them have been affected mentally, and some of them have even committed suicide. So it is a very serious topic. And we remember that ER medical doctor back in April, in the middle of COVID-19, Dr. Brenda Brain, Dr. Lorna Brain in New York City who committed suicide. So this is a very serious topic. And we are grateful for all of those healthcare workers who put their lives on the line to care for patients of COVID-19. We know it's not easy, but the vocation, we know that these workers, they have a greater calling, they have a greater purpose. And that's why they are answering yes to that call to get up every morning, leave their children, leave their house, leave their husbands, leave their wives, their significant other to go fight that battle on the forefront. So we are grateful. Why don't we take 30 seconds silence just to honor those who may have lost their lives taking care of COVID-19 patient. Let us take 30 seconds of silence. Thank you so very much. Well, our guest tonight is a wonderful professional, and we're going to be learning a lot from her. She has an extensive bio, out of which I'm going to read just a little tiny portion of it. Her name is Miss Pauline Louis Magist. C'est une nanou, li haïtienne. Et c'est avec plaisir que nous allons welcome, que nous allons dire bienvenue sur plateforme Thursday Night Live avec Pastor Sarah Batroni. So I'm going to go ahead and read a little bit. Like I said, her bio is quite extensive. I'm going to read a little bit of it so we can give her a little bit of we're going to acknowledge where she comes from, her journey, and all of that. All right, so Miss Louise Magis began her nursing career 20 years ago when she became a licensed practical nurse after receiving her practical nursing certificate from Lindsay Hopkins Technical School in 2000. So from that journey, she proceeded to be in surgical intensive care, cardiac step-down, telemetry, clinical nurse educator, and coordinator of the newly hired nurse preceptorship. As first, she also was the vice president of HANA in 2017 and 2019, second vice president 2015-2017, assistant treasurer, chair of recruitment for the association in 2013 through 2015, and co-chair of public relations and legislative affairs committee. And as an active member of the association, she received numerous recognitions for her services and dedication, such as being the first recipient of the Rookie of the Year in 2012, Nurse of the Year Award in 2013, the prestigious Presidential Choice Award, and two-time finalist for the March of Dimes Nurse of the Year for Critical Care and Nurse Educator Awards. In 2008, She was awarded Nurse of the Year for Step Down by her peers for her compassionate and exceptional patient care. Ms. Lewis has shown her passion for nursing in her community not only through her voice, but her action. If you see a need and you are in a position to help, don't wait to be asked. Volunteer yourself. Ms. Lewis is also a member of the Florida Nurses Association, American Nurse Association, and the local chapter of the International Nurse Association. Ms. Lewis is currently the president of the Haitian American Nurse Association. Ms. Lewis' passion for the nursing profession has deemed her a leader and advocate for the nursing profession and her community, an educator and a mentor for new nurses. Please help me welcome in our midst to this platform, Ms. Lewis. Welcome.
Thank you, Pastor Vetrani, for having me. Hello,
It is a
everyone.
real pleasure. Thank you for accepting this invitation. It is, I know right now things have changed, and I know we all are very busy. We're trying to juggle everything at once. So it's not because we lack things to do when we come on this platform on Thursday night. It's because we care. So I thank you also for caring. Tell the viewers a little bit more about yourself if you don't mind.
Well, I think you covered pretty much everything. It's on the bio. Yes, hello everyone. Once again, I am Pauline Lewis Majis, and I am the current president of the Haitian American Nurses Association of Florida. And I say Florida because we have 11 chapters nationally. We have chapters in New York, Greater New York, Hudson Valley, New York, Garden State, New Jersey. We have chapters in Illinois. We have chapters in Maryland. We have chapters in Georgia. And in Florida alone, we have 4 chapters, which is Hannah, Florida, which is our Miami-based chapter, which I am the president of. We are the mother chapter because we were the first to be formed and incorporated 36 years ago in 1984 by Jacqueline Das and Alice Casimir. We have a chapter in West Palm Beach, which is our newer chapter, along with Orlando, and a chapter in Tampa. So I'm also, of course, as you read in my bio, I am a registered nurse. I still do work at the bedside part-time whenever I can. Mount Sinai Medical Center, I'm a critical care nurse. Of course, with COVID, we converted to being a COVID ICU nurse as well. I'm also a full-time nursing faculty at St. Thomas University. I teach at their undergrad baccalaureate degree program as a nursing instructor. I am a mother. I'm a community leader, a church member. And I'm also part of course, I can't forget this, because of COVID, there was a task force that's called the Haitian American Coalition for South Florida. I am a member of that coalition and a team member of the health task force for that coalition. So, and that's me.
Wow, my goodness. I'm sure you could go on and on and
Yeah,
on.
but I know we don't have that much time.
I did not want to read the entire bio, or we would be like, here all night. But this is wonderful to see your involvement and how busy you are. Again, like I said, it's not because we are lacking of things to do, but it's because we care. We believe in the greater calling. We believe in a greater purpose to help our community. Et là, sur plateforme, ça attend-nous à ce que vous recevoir des informations qui sont importantes pour notre vie sociale, qui sont importantes pour notre vie journalière, qui sont importantes pour nous capables de fonctionner dans la société. Parce que de bagages, de fois, bagages ont échappé nous. So it is very important, and I'm so very humbled. I'm so glad to have you, Madam President, and to see what amazed me about your bio is to see the journey that you have taken up to the
Yes.
place, up to the position that you now have. Ça son bagay sérieux, son bagay qui pa gen jouet là-dedans parce que ou sorti de très bas si nous capable dire ou commencer
Mhm.
avec Lindsay Technical School et puis pour monter arriver jusque là now you are president of the Haitian American Nurses Association chapter for Miami, Florida. This is great and ça encourage nous le
Mm.
dans position qui pas élevé right away pour nous capable continuer. What do you say about that, Madam President?
Oh, it's been a long journey, and it's only by God's grace, et par grâce à Dieu. Moi, commencé à l'âge de 21 ans comme your medical assistant, and après David Maggie, fait Timon, and then when décidé retourner, go back to school. Moi, fait Lindsay Hopkins, and even my daughter, when you were reading the bio, she's like, "Wow, 20 years! It's been that long that I've been in the profession." So I did, because at that age in my game against Simone, and it was difficult for me to continue school the way I wanted to. So I did the step by step. And like I said, it's by God's grace that I am here today, which is an honor and a privilege for me to be sitting here, like you said, from where I started from, to becoming the president of one of the most respected, professional, and prestigious organization in the Haitian American community here in South Florida, and of course nationally, because we're growing as a chapter, and we're growing so much to the point that we started an international chapter because we have had nurses from outside of the United States that have reached out, Haitian nurses that are living in other countries, and they wanted to start a chapter too. So we started an international chapter so that way our nurses that are probably living in Turks Island, that are probably in Japan, and they want to start a Haitian nurses chapter, they will fall under the umbrella of the Haitian Alliance Nurses Association, we call it, which is the international chapter for HANA.
Wow, that is wonderful, and I love to see. I love that you talked about the expansion of this great initiative that started way back. You said in 19 in what year?
1984. It
1984.
started. Hannah started as it was two nurses, two Haitian American nurses. They were called upon to, if anybody knows the history of the of Miami with the immigrants, with the Haitian immigrants in the Crum detention centers, and then you had the people that were working in the in the farming area, in the homestead area, and they needed uh, nurses who spoke Creole to help them out. So when these nurses were called upon by the county to help out to translate, they're like, we have to do more than just be translators. We have to be able to help. So they started this nursing organization along with other healthcare professionals, Haitian professionals in the community. So it wasn't just nurses. You had doctors, you had microbiologists, you had
Wow.
engineers. So they started this association. And then in 1984, they incorporated. It was started as a way for nurses to come together as a group and, of course, provide community services. So 36 years later, we are still going, we are still strong, we are growing. And it was such an honor and a privilege for me. I remember I tell people all the time how I decided to get involved. I was a member for about a year, but didn't really get involved. I became a member in 2009. Didn't really do much, didn't really get involved. And I attended a meeting post earthquake, and I attended the meeting and I saw what these women were doing. And I'm like, I want to be a part of that. So 11 years later, I'm still here. And I was
Wow.
elected in 2019 as the president. And then, of course, COVID happened and have to step in and be there for the community
Right,
like
right.
Hannah has done for the last 36 years.
Yes, wow. And I truly applaud this And what I see in this, ça moins dans ça, c'est que deux infirmières, bien entendu, ou dit comme ça que gen l'autre monde, l'autre professionnel qui est ensemble avec eux, yo commencé. Ça c'était un petit commencement. Mais ça veut dire que yo pas ouais nécessité que dans la communauté. Hein. Et j'en dis back then, le workers yo vini, le moun yo back then in the 80s, c'était l'ère de boat people. That was the era of the boat people who came on shore in Miami, not speaking a word of English. So there was a great need and they saw it. They decided to answer. They decided to do something to respond to that need. And here we are today. That is so fantastic. That is absolutely wonderful. And I'm glad that you are part of it because nous besoin moun dans position ça yo nous besoin moun qui ka connecter nous le nous besoin quelques services dans communauté and that's what you are here to serve our community to make a difference and we are grateful for you Madam President. Also you mentioned COVID-19. We know how it's been since March, since the shutdown of the entire world, how COVID has affected everyone from the least to the greatest, okay? Everyone is affected by it. Not one person cannot sit down and say, I've never had a bad day during this whole shutdown time. Not one of us. If we say that, we would be big liars, okay? But li affecte nous non façon l'autre, ok? Grâce bon Dieu fait que nous capables naviguer, que nous capables camper toujours, mais que de fois on senti comment l'affecté. How has it affected, besides the world at large, besides the international community, all the patients and the caregivers? How it has, let's zoom in, let's zero in on our community, on nous fonti camper dans communauté noire, pour nous comment COVID-19 est mentionné. I mentioned earlier in the beginning that one of the cases that made the headlines back in April, I believe, was that ER medical director, Dr. Lorna Breen, who committed suicide in New York City because the weight was too much for her. She contracted the disease. She was sent home. She was in quarantine, came back, and she probably got sick again, and they sent her back home again. She could not take it. She committed suicide. This is how heavy this thing can get on a human being, on a medical professional. How has this affected our community, the frontline workers, the nurses, the assistants, the physicians, the assistant physician, the physician, and even the LPN, everyone who's taking care of patients, who have patient contact? How has this?
That's a great segue. Yes, everybody has been impacted by this. Everybody in the healthcare, that work in the healthcare field, from the CEO of the hospital all the way down to the janitorial person, the custodian person that's cleaning the room. As far as the nurses, of course, we know the nurses, they are the one that are in most contact with the nurses and the doctors, of course. They are the one that are in most close contact with the patients while they're in the hospital. You mentioned about that doctor that committed, the ER doctor that committed suicide. Of course, we know mental illness is a very serious aspect. Whether or not she had an underlying issue before COVID, and COVID just magnified that, and she, like you said, she couldn't take it anymore, and she was not the only one. There have been others before her and after her that have also committed suicide. So the mental aspect, the psychological aspect of COVID, the effects of COVID on healthcare workers is something that you don't really hear people talking about, but it's real. It's real. And I can talk about my own. And when I say my own, I'm referring to our Hannah family, because we are a family. We call ourselves Hannah, a family. Not just our here in our Miami chapters, but we have four chapters, sorry, in total up north. That's two chapters in New York, the state of New York, and two chapters in New Jersey. We had the president of our HANA of Greater New York and the president of our Rockland County, New York chapters who were positive for COVID, who were tested positive. Our president of the Greater New York chapter, she was on another segment. We did a Facebook Live with the coalition talking about her experience. And she was sick for months, to the point where the sense of taste, the sense of smell, you hear that, had to be on continuous oxygen. Even when she was at home, having the nurse to come into the house to provide care for her. So we get to see our own being affected by the COVID itself. So you have that, not just dealing with that, you're dealing with taking care of patients in a hospital with a disease that we have no cure for. So, we're used to providing care, uh, providing the proper treatment for our patients, watching them recover, and watching them being discharged home. And now you're at a point where you're providing care for patients, and you're not seeing the rapid recovery that we're used to. So that can hold a huge effect on our nurses and, of course, the doctors that are caring for the patient. So the mental aspect of it, long term, because we can't just think about when what's happening now. We also have to think about the post traumatic effect of COVID once this is all over. So it's a big issue, and it's something that is really not talked about a lot, and we really need to get that conversation started when it comes to the post COVID, and also to currently of COVID. And one of the quick things I don't want to talk too much. You have nurses that are dealing with family members. Not only are they taking care of COVID patients in the hospital, but they have their own family members also that they have to take care of. Their parents, their grandparents, or even their own children that they're not in close contact with the fear of possibly giving the disease to their family member or their children. So there's a lot of mental aspect or psychological aspect of COVID that we're not really hearing a lot of conversation about. I was at another session, and there was a young doctor, uh, finished his fellowship, just started working independently as a doctor about 2 years, and he works in a hospital, and he was talking about having to pronounce 3 and 4 patient dead at the same time. So imagine a young doctor just getting into the profession, having to be in that situation. So it have to have some kind of mental drainage that's attached to it.
Right, right. I'm glad you mentioned something. You said that these top professionals who were who contracted the disease, and they were sharing that information, right?
Mhm.
How important is it for those who are in positions of leadership, if they do contract that disease, to share that experience and
Mm.
let people know how it was and how actually they overcame that? Because
Yeah.
quite frankly, this is becoming like a stigma
Mhm.
in the Haitian community. I know some people, even though they had the symptoms or they feel sick, même si moun nan te malade, li konen gen tout symptômes COVID lan, lap dou en vérité 3 fois c'est pas ça, etc., etc. How important is it to share that information? Si peut-être ou ta affecté par virus là, et puis bon Dieu mettez de dehors.
I think that is very important. Li trez important because gen an pil moun actuellement jodi a ki toujou pa kwe ke maladi a existe. So li trez important pou yon moun ki fe eksperyans lan pou ta pataje eksperyans yo te profit yo avec communauté a pour moun ka comprendre et nous tande que gen moun k'ap mouri même gen moun c'est parce que yo pa gen moun pa yo ki mouri so yo pa kwa que li existe vrai so somebody that is recovered a recovery COVID recovery patient, especially someone that is in a position of leadership, position of being in the community, I think it's very important for them to share their story, share their experiences, so people can understand it. People can see it. I've been a nurse for 20 years. December, of course, is going to make 20 years. And in my current practice position, I work in a cardiovascular surgical ICU, and my first COVID patient. And I could remember it because I work part-time, so I'm usually on call. And my boss, said, I need you to come in on this Saturday. Can you come in? And I was like, okay, I'm free from Hannah. Usually Hannah, takes up all my extra time, all my weekends, but I love it. And I went in. Of course, I had the fear going in like, okay, the fear of you possibly getting the disease. But when I walked into the hospital and, you have this feeling that, okay, this is what I do. I'm a nurse and I'm going to do this. So after, you went to the process, you go in, you got it gowned up, masked up and everything, and you're ready to work. And I get the report of my patient. And when I go into my patient room, my patient was not doing well. And everything we tried, the medications, the ventilations, the this and the that, and the anesthesia, everything that and when I say we, meaning the team, because it's a team of doctors between the infectious disease, the pulmonologist, and the ICU doctor that's caring for the patient, and me, the nurse that's there, that's, carrying out their orders in whatever they feel the patient needs to try and improve that patient breathing, their respiration, their lung status. Nothing was working. Nothing was working. So for me, and I was like, why isn't this working? It's supposed to work. This medication is supposed to do this. Why isn't it doing that? The ventilator setting is supposed to help increase the patient lung capacity so that he can receive the oxygen that he needs. Why isn't it doing that? So at the end of my shift, and as I was leaving, I'm giving report to the next nurse that's coming on. I'm telling her this is the process we're going through, and this is what we've done, and this is what needs to be continued, and so on and so forth. And I'm sure nurses out there understand what I mean by that, given the handoff report. And as I'm leaving the hospital, I get in my car and I'm sitting there, and I'm like, no, this shouldn't be happening. And that day I came home, went to the garage, took my clothes off, went straight to my bathroom, took a shower, and I locked myself out up in the room. And I started reflecting on that whole day. And I could not sleep that night because I couldn't get that vision out of my head with my patient laying there and doing everything possible to try and help that patient. Tout ça nous fait, nous pas qu'à aider patient. To the point where I went on social media and wrote a long post. I've never experienced this before as a nurse. I mean, I've seen patients die as a nurse. We've coded patient. I've seen patients with terminal diseases die, but this is something that we normally would fix. And to see that it was so difficult for you to make that patient better, and it did something to me. And you hear the stories, there's so many stories from other nurses, you hear stories from doctors, you hear stories from other healthcare workers. So all of these stories on top of stories, it does create that. So sharing your story, letting somebody else know that, listen, you might be afraid, parce que gen moun jan di, yo gen symptômes yo senti, but yo still pa kwe ke se maladi a yo gen. And then le yo rive l'hôpital la, maladie a gen tan ravaje poumon yo, because se poumon li kaze. Si tou frère akse nou yo ki gen tension, ki gen sik, ki fait maladie kidney, qui fait maladie ke, se moun sa yo lè l'affecte, li affecte yo plus, yo souffri plus, yo pa vle à l'hôpital, gen moun ki zou yo pa gen COVID, yo pa pa l'hôpital because si à l'hôpital la ya ba yo COVID. Gen moun ki pe ale l'hôpital pou sa. So, si gon moun ki kache e pataje informasyon, pataje eksperyans, share their experience, I think that's very important to do. And that's something, speaking about it too, when you speak about it, it removes that sense of, I guess you can use the word depression, that sense of anxiety that people feel because of that. So I think it's extremely important to talk about it.
Yes, absolutely. Thank you so much. And I can imagine when you say that day when you went home, you just kind of um, stayed by yourself and reflecting on the events of the day with a feeling of help, of hopelessness, because like you said, you are a professional and you're supposed to make people feel better. So when your patient is not feeling better, whatever you do, I'm sure that's affecting you, that's affecting the entire team that was with you. Now, in your experience, na experience PAO, est-ce que how has COVID-19 strengthened the relationship, the physician-patient relationship? Has it strengthened it in a way that people know that only, the physicians can actually help me, of course, après mon Dieu. Or have they become more, have they had, do they now have more distrust towards physicians during this period? Or the other way around?
Well, from my experience, from what I've seen, especially patients and their family members as well, even though the family members are not allowed in the hospital to visit their family member that is in the hospital for COVID, it has strengthened the relationship because now the doctors have more of a connection with the patient. They have a connection, even though the family is outside of the hospital, the constant talking, even the nurse. One of the things, again, and I can speak more from a nursing perspective because that's what I am and that's what I do. The COVID patient, when we had the peak of COVID, when patients were dying and more patients were dying, and the family members, of course, were not allowed. So normally in the hospital, if you're taking care of a patient and the patient is near death, the end of life, the family will come, or if then the family is not around, we will call the family and said, we think you need to come in, But with COVID, you couldn't do that. So the nurses were left to using their personal phones. If they had an iPhone or the family had an iPhone, doing FaceTime with the family members to let them say their goodbyes to their family who is about to get their last breath. So when you see that compassion, the nurse providing and the doctor giving that compassionate care, that has strengthened the relationship, the patient, the doctor, the patient-nurse relationship because of COVID. Now, there might be some, you do hear the talks outside, the distrust because of all the conspiracy theories that are out there about COVID. And then some people have a tendency to lie more on the conspiracy theories that are out there that don't go to the hospital, they're going to give you COVID. The numbers are hyped up. It's not true. And because of all of this, there are some groups of people that were afraid to go to the hospital, even for routine illnesses, not just COVID, but for routine, like someone who glucose level, we say sugar in the community, sugar level is too high, but they're afraid to go to the hospital because they think that if I go, they're going to give me COVID. Why? Because this is the things that they were hearing in the community. So I think the trust is built up it's improved because of that, because of COVID. Yes.
Okay, great. The mental part that you mentioned is affecting the health care workers on the mental, at the mental, mentally. Is Hannah provide any type of mental care, or actually is there any routine care provided to the workers in Miami or in the in South Dade, in that area, or Broward? I mean, what do you do? Do you have weekly meetings, monthly meetings? You know, what do you do to provide mental health to the healthcare workers
Oh,
in that?
that's a great question. Thank you for asking me that question. Yes, in Hannah, we do. We have various things that we do. Like I said, we're involved in various coalition. One of the things that we did, 2020 was proclaimed the year of the nurse, and it wasn't in any way that COVID will show people what nurses really do and who nurses really are. So 2020, we were supposed to celebrate the year of the nurse to commemorate the 200 birthday of Florence Nightingale, who we all know as the mother of modern day nursing. So we in Hannah, we have a gala, an annual gala, which is our biggest fundraiser, and we give out scholarship to nursing students every year. So we were in the process of planning the gala. So COVID happened. We had our nurses that were ready. We had a theme. We were going to have a big celebration to celebrate the year of the nurse. So COVID happened. So we're left at, okay, what do? We have to do something. And I'm hearing the stories. We're all hearing the stories. As the president of Hannah, I'm getting the phone calls. Madam President, this is going on. This is going on. I don't know what to do, and we saw the drainage, we saw the depression. We started to do. We had a show that we used to do that we call Cause Santé avec Hannah. It was a radio show and also a TV show. So we're like, well, let's use our social media platform and we can do Cause Santé. And for the community and also for our members, we can talk about mental health and the mental aspect. We also had meetings where we invited our members to participate in Zoom meeting and asked them to share their stories, how they were feeling. One of the things I started doing was I highlighted our nurses, our members, where they work, and we salute them for being frontline worker, and we would post them on social media, post them on our WhatsApp chat. So and that was a boost for our nurses. It made them feel good. We did the nurses celebration. It was a beautiful Zoom celebration. We had music. We gave out the 10 scholarship to nursing students, because even though COVID was going, the students were still going to school and they still needed to pay their school fee. Also, to our other chapters, also has done Zoom webinars where that talk about taking care of yourself, taking care of your mental health. We collaborate with the coalition with Rebati Sentimental, where they have different sessions on mental health aspect session. We normally have our monthly meeting, usually in August, July and August. We don't have meetings, but we do communicate. And of course, we have our meeting coming up in September, which will be a Zoom meeting for our membership. And we allow them to speak, sometimes to share their experience. And not only their work experience, but also to their family experience, what's going on in the home, how are things. And we have a couple of our nurse practitioners that are mental health specialists. They're mental health nurse practitioners. They're there. They offer their time, their phone numbers. I know I've used them myself, calling them when I'm feeling overwhelmed, just to talk about what I'm feeling for today, what was going on, and so on and so forth. So we try our best as an organization, as an association, to make sure that we engage our members and let them know that we are here for them, so that they can speak about their experiences, because we know firsthand what the mental aspect of COVID and not just on them, but also to share about their family, what's going on in your family, and what advice we can give them for their family. Like one thing we can talk about, members that have young kids, but then they still have to work, and then the kids have to go back to school. So there's a lot to talk about, and we try our best to keep our members engaged.
Absolutely, and you are doing great work in the community. Just so you know, you mentioned mental health, a couple of mental health specialists in Hannah. Marjorie Losama was with us, matter of fact, a few months
Yes,
back, and
yes,
she did talk about mental health. So
yes,
she was on this platform on a Thursday night live. So wonderful, wonderful. Um, uh, True servant leader, Marjorie
yes, yes,
Losama. She was the ex-president of Hannah.
yes.
Yes. So,
Mhm.
and I can attest that you are indeed giving out scholarships in the community because in 2019, prior to, yeah, it was in 2019, I'm not sure when your banquet, your gala was. I have a good friend of mine whose daughter received the scholarship. So yes,
Awesome.
I can attest to that.
Yeah.
So wonderful. We have a couple of questions. Ma rappelez nous que nous notre Thursday Night Live avec Pasteur Sarah Patroni, côté nous porter information pour notre communauté. So, tâche ou leur monter sur live ça yo, c'est actif, c'est pour participer activement, c'est pour commenter, c'est pour partager live là tout parce que nous croyons que, j'aime t'ai dit tout à l'heure, c'est pas on bagage que nous fait comme ça à la dérive, vous comprenez, vaille que vaille, mais nous programmer pour ça, pour nous porter de bonnes informations pour notre communauté. Et nous faisons en anglais, nous faisons en créole, tout guest nous yo, majorité de guest nous yo parler créole. Et notre communauté pas nous, ce sont des professionnels qui sortent dans la communauté pas nous, et nous toujours contents pour nous porter au bas où. So, nous demandons pour partager live là parce que nous croyons dans purpose, nous croyons dans vocation, nous croyons dans appel nous pour nous servir la communauté à la façon ça, d'une manière spirituelle, mais aussi d'une manière sociale. Donc, nous croyons que vous partager live ça pendant que vous regardez, vous posez questions tout, ok, à Madame Présidente Pauline Louis Magiste. Je crois que j'ai une question pour vous. Comment nous sommes capables de faire dans la communauté haïtienne, ou du moins, let me faire camper sur ça. Qui plus gros cas que vous expérimentez depuis que COVID a commencé dans le temps et travailleurs médicaux, ce soit en nurse ou bien LPN ou bien CNA, qui ont contact avec les patients, qui ont nettoyé l'hôpital, un docteur, un chirurgien, un administrateur, tout, qui plus gros cas côté gagné pendant COVID-19 a commencé jusqu'à présent? Ou bien est-ce que tu as un gros cas côté que it was a little bit overwhelming?
Well, in general or for me personally?
No, in general, for the communauté haïtienne, non, à côté où on va développer.
Well, na communauté,
Gros cas que tu as rencontré, est-ce que tu prends un choc?
Yun na pigwo problem nou te renkontre na communauté haïtien, c'est the lack of testing. En pile, nou pale de moun kap travay l'hôpital, but nou pa kabile moun ke nou rele essential workers nan communauté nou yo. Nou gen moun kap travay nan hotel, moun kap travay nan jardin, moun kap travay nan Walmart, moun kap travay nan Publix. So these are our essential workers. Même les everything else was shut down, those things were still open. Yun na pigwo ka ke nou te renkontre, I think one of the biggest issues we had in the beginning of the peak of COVID in South Florida, na communauté haïtienne, c'est lack of testing. So gen an pil nan moun sa yo ki pa jam teste pou COVID, gen an pil nan yo ki te malade, paske si nou rappele nou, au komansman COVID, to get testing for to get symptoms, you had to have symptoms. That was number one. Number two, the testing centers were drive-by. Ça veut dire sou pat gen machine, ou pat ka ale pou yo tal teste yo. And troisièmement, gen an pil nan sant yo, the testing centers qui pat localisé côté moun nan communauté nou yo te ka jwen yo facile. So, yon nan bagay ke ensemble avec the coalition, the Haitian American Coalition for South Florida, ke Hana fait partie la dan mwen men mwen fait partie nan Health Task Force la, nou te, we've kind of fought to get a testing center that was centrally located in the Haitian community. With the testing center to encourage more of our people, moun nan communauté noire pou al tester, centre lan c'était nan Holy Family Catholic Church ki nan North Miami. Yo te vin ouvri centre lan, and then yo te ouvri yon façon, même sou pa gen machine, ou ka you can walk up, ou vini nan bekan, yo pa prefizo. In the beginning, ou pat bezwen apretman, but after a while, when it got, really busy, when the peak gen pil moun ki tap retoune travay, and travay yo te recommend that they get tested before yo retoune travay, ou travay yo voye yo al teste. So yon nan pi go ka nou te renkontre, nou gen pil moun nan kominote nou ki te test, qui te gen positif, qui te gen COVID, mais qui pas jam point test, yo et malade la kayo, qui juste yo vin rive in a state where they were critical. Gen yon zanmim ki gen yon tonton ki mouri kon sa. Tonton an te senti symptoms COVID, li ret la kay, a boite gingembre mélangé avec girofle, mélangé avec l'âge, au citron, nous connaissons comment nous mélanger te yo. And li vin paka pa bon ko, li vin paka pon souf encore, li rele 911 pou li rive l'hôpital la, right there, he was intubated, and the next day he passed, because he te get rive to water. So, manque d'éducation, people not being compliant, especially with the mask, wearing the mask. Ou tan de moun ki do, pa mette mask, ou mette mask, it's going to prevent oxygen from going to your brain. So mte fè yon ti video, yon jou lè mte so travay, mchita nan machine nan, and then yon moun voye sou WhatsApp pou mwen yon like a video, kap di, yon lot, en Creole, kap di, mask, a fè de bay mette mask, nou mette mask, sa bde, se sit la bde se la. So, mwen te yon ti jan fache, lè mwen video sa. So, kon yon la, mchita nan machine nan, mso travay, finish taking care of patients, COVID patients, mchita nan machine nan, mdi ki te mgade mesaj la. So, lè mwen video, I'm like, oh my God. So, now, pandan mchita nan machine mwen, mzi, mpon kamera, fè yon video. Mzi, na plein de mette mas, yo di nou meton ti mas, si nou pap soti, sou pal nan market, meton ti mas, proteje tetou, na plein pou sa. Imagine yon infirmier, yon dokter kap travay nan COVID unit, kap mette de mas pou 12 etan. Se pon sel ti mas la, nou gen mette N95 la, and then pou mette lot surgical mask la devan, en plis ou gen yon shield ki pou bare figou, 12 hours. 12 hours pour mettre massa. So, ou même qui dans communauté a yo dou mettre masse ou pas sortir sous nan public, social distancing, ça un problème pour. So, again, lack of education, manque d'éducation. So, regardez les informations COVID yo tap sorti, en pile nan information pas sorti en créole. So, communauté a, et les n'a fait des séries, c'est pas tout le monde qui connaît kapal nan website, qui connaît pou yal nan website, the county website or CDC website pou yo chache information. So it's up to us in the community to provide that information for them. So education is a big aspect, lack of education, lack of communication, not using the proper resources that we have. Nou konen communauté nou an, c'est WhatsApp yo, c'est yo, the TV haïtien yo gade pou yo tande information sa. So in the beginning, and I think still now, even konya, because tout bagay ouvri, gen pil moun ki pense que COVID fini. Li pa fini, li la toujours. Li la toujours. So manque d'information, manque d'éducation, involvement, and c'est tout moun qui pou partager information. Ni l'église yo too, I commend you for what you're doing using this platform to reach the community. However you can get to the community is very important that we're able to do that, regardless of what position you hold in the community. And I always urge those that are in position, that has that voice, to be out there in the community, to provide the information that our people are not getting from the people that's providing the information. Ou même ou ka jwenn information, mais yo même yo pa ka jwenni. Lo jwenn information, utiliser yon plateforme pour porter information by communauté. You're muted.
Thank you so much. So, like Jean nous t'a dit, c'est pas seulement thank you, c'est pas seulement partie spirituelle pour nous take care, mais aussi partie sociale, partie pratique là, ok, pour nous capables aider communauté. Ou parler de manque d'éducation, manque d'information, le monde n'a pas informé, donc il était dans petit cocon il était dans petit trou et puis la mourir avec un bagage qui, s'il te prend plus bonheur, lungs pour moi on va taper shot, pour moi on va taper rempli avec fluide, ok. En plus de manque d'éducation, moi penser tout pour communauté qui pour immigrants spécialement pour ceux qui pas légal qui pas de papier yo, tu parlé de monde qui travaille dans jardin, ok. Dernièrement on t'a regardé un documentaire côté yo dit que gain des travailleurs qui dans jardin, c'est pas dans communauté pas nous dans communauté Panyol, quoi c'est mexicain yo té, y a travaillé dans ferme, ok, c'est là yo été yo gain ti caillou etc. Mais en pile là-dedans yo gain Covid là, ok. Premièrement, yo peur parce que yo pas de papier. Donc ça c'est une question d'immigration, un problème d'immigration. Yo pas de papier, yo peur pour pas le tester. Yo peur pour yo pas le travail parce que si yo pas le travail, il y a perdu journée, yo pas qu'à toucher. So premièrement, yo un problème d'immigration. Deuxièmement, yo un problème de travail là, les même boss là où yo travail pour yo qu'à toucher. Troisièmement, yo oblige à le travail et puis infection même à multiplier. Est-ce qu'on est dans le cas population qui pas de papier yé so qui ça nous ta capable dire à un monde qui pas de papier dans la communauté pas nous ou sentez pas bien ou sentez que la fièvre ou sentez gorge va faire mal ou perd du bouchou perd du sang etc. ou gain la fièvre zo a fort mal. Est-ce que mon n'a qu'à juste rester parce que le pas de papier pour pas le tester? Parlez-nous de ça, s'il vous plaît. Ça sont questions d'immigration.
Yon nan bagay m'ta reme communauté à comprendre. Your immigration status has nothing to do avec santé et soins que y a ba ou. Même si ou pas gen papier, si ou sent ou malade, l'hôpital pas refuser bon santé et bon soin. Yo pas qu'à refuser ça. Ou pas gen papier, ou pas gen assurance, ou aller l'hôpital, y a toujours bon soin. Non, yo pas prêt l'immigration pour. You know, gen moun qui pense exactly, gen moun qui pense si à l'hôpital parce que yo pas gen papier, l'hôpital la prêt l'immigration pour venir pour yo. Non, yo pas fait ça. Et m'ka bon un exemple. Et nous gen et Dr. Marie-Etienne, qui c'est un past president of HANA, c'est lui-même qui président et HANA International. He volunteer with the county with the testing as a translator. Li ta allé South Miami pour ta faire translate dans un samedi. So qu'on y a là pendant y a fait li ouais un jeune tinois qui a passé et li dit ou ta aimé vinn faire test Covid. Ah non, pas faire bail comme ça, li dit non, mais vinn il dit so qu'on y a tombé poser question. Ah yo dit si là on fait test là, c'est que Covid là même y a bon moins. This happened about 2 weeks ago. This semaine de ça passé. Et yo dit qu'on ça l'a fait test ça c'est COVID là même yo mette nan ou même pour yo ka di gen COVID. So he did no. So she started to educate. Il commence à éduquer. Il dit m'pa ba information non qu'on y allait demander l'information, li paie ba information li parce que dit s'il ba information li et y a vinn chercher immigration, y a voye immigration pour venir arrêter. Là ba information. And it's important too because you one of the things.
I have a question. Sorry to cut you off.
Okay.
Sorry to cut you off. Ça c'est intéressant. Est-ce que y a pas un point qui valide? Est-ce que alors nous juste à demander ça pour nous capable mettre information en dehors, OK? So est-ce que moun nan pensé li gen pensé ça? Est-ce que ça pas valide, li pas valable parce que on a dit oui à bon soin pour le moment. Mais l'on va adresse dans 2 mois, puisque le système l'hôpital là doit connecter avec le système immigration pour les gens qui n'ont pas de papier. Est-ce que mon gens l'a pensé? Est-ce que le pape dit oui, après 3 mois, ma pour immigration débarquer, soit la caille moi ou bien. Est-ce que ça me dit là?
Moi, je comprends ça dit, non. Système l'hôpital, yeah, okay. We going to say de l'hôpital qui fait branche federal government. Ouais, est-ce que l'hôpital la voit information moun nan ba immigration pour dire que mais moun sa li te vinn penser l'hôpital là li pa gen papier de quoi pour immigration à la arrêter moun nan faire arrestation déporter moun nan? Non. The purpose of that, gen yon bagay nou le contact tracing. Contact tracing. So c'est une façon pour yo connaître combien moun nan communauté a qui ka affecté avec COVID. Ça veut dire si ou gen yon moun qui vient l'hôpital là, moun nan gen COVID, kon ya la le yon mande information, autorité, combien moun qui en da kay la, a ki moun ou te nan contact. C'est pour yo ka fait yon trace of how many other possible people, combien l'autre moun ke moun sa qui testé positif là te ka affecté à cause de te nan contact avec moun sa. Information que l'hôpital là prend your demographic information. Donc, vous souvenez ou dit c'est Haitian American. Quand y a là nous même dans communauté haïtienne. Si on t'a demandé nous combien haïtiens qui étaient affectés avec COVID, we cannot provide that information. Why we cannot provide that information? Because nous-mêmes we fall under the category of Black non-Hispanic. That's our category. So, les yo point information de yo du kon sa que there was 90,000 African American positive for COVID. Now 90,000 African Americans qui étaient positive or 90,000 Black, ou pas comme combien yo qui haïtien qui étaient affectés. So you know, I want to mention the census. I'm sure you know. I know it might be a little bit. It's not really off topic. So we are in a year of the census. Côté ap yo laisse recensement en créole. Côté ap collect information. The census nous connaît recensement c'est lui-même qui fait nous connaît combien de monde qui était dans zone qui était dans communauté that live in a municipality. So pour yo ka gouvernement ka buy resources, provide resources to that community. So what calculate? So let's in Sinudi, North Miami. Côté nous connaît gen pile haïtien qui vivent dans North Miami. I'm not really sure of the numbers, you know, of the demographics, the numbers of the Haitian population in North Miami. So, les affaires, y a ramasser information pour yo connaître comment pour yo buy resources pour communauté ça. Si nous avons gagné l'autre pandémie, y a dit dans communauté haïtienne c'est 1500 moun seulement nous te gagné. Mais nous-mêmes peut-être pas nous à cause des familles, des amis, des informations de ça nous connaît 1500 ça qu'a multiplié par 10. To say we had more than that, just 1,500 people. So, les moun nan pe ba information, gen pile projet, en pile ressources qui ta entré dans communauté que nous pas joindre parce que moun nan pe. Non, a fait de cause que sous ba information, y a voye ba immigration pour immigration ka vin arrêter. Non. Non.
Okay.
That was an interesting question.
Merci. Donc, dans ce sens, je suis content de dire un point ça qu'on fait passer. Nous faisons partie de Black non-Hispanics. Ça veut dire que numéro yo pas jam compter vraiment. Dans ce sens, qui provision que HANA, Asian American Nurses Association, est capable de faire, qui, qui phase, qui étape, qui steps que tu es capable de prendre pour le capable peut-être faire des healthcare, des policies passer côté, pour capable que d'après census 2010, là, il y a peut-être 900 000 ou bien plus haïtiens qui vivent aux États-Unis. OK? Est-ce que nous sommes capables de faire un bagage dans ce sens-là pour nous capables de grouper, pour nous capables de grouper haïtiens en un groupe dans particulier PAL? Est-ce que un bagage qui t'a fait dans ce sens-là?
So you know bagay kinap travay along with the coalition that I mentioned, the Haitian American Coalition of South Florida. Nap gumen pou sa. From the county level, from the state level, Florida Health Department, pou yo ka include nan form yo. Yon parti de sa. Now, sa nou toujou ankouraje moun yo, le nou pale avek yo, nou di yo kon sa, lo ap rempli form nan wap rempli demographic information nan, kote yo mande yo, are you white, black, Hispanic, or other? Ba other, check other and mette Haitian American. Now, of course, again, it goes back to the immigration status, right? But it's not going to affect you pa vina fè arrestasyon vina arreto la kay la. So li très important for the future, for not only for resources, to make sure that when you completing the form, ou mette ke se haïtien ou ye. Because le ap konte, yo pa konte nou. Nan kominote a yo pa konte nou. Because le nou rempli form yo, pa gen kote pou mette ke se haïtien ou ye. So, there come again, you know, HANA members, you ki tap travay in the with the COVID testing. She was working with the Florida, the Department of Health. Li tap fe COVID testing, you know, kote yo bezwen lale, le yo bezwen nurse lale. So, you na ba elem palavel, mi si mandel, lo we Haitien yo vini. Esko we yo mette ke se Haitien yo ye? Li di, non, gena yo pa mette an yen, yo kite blank. Because yo pa we haïtien, yo pa metan yen. So m'dili, wou we sa encourager yo pou yo ekri under other Haitian American, because we need those numbers. We need that numbers for research purposes, for resource purposes, because nou ta reme konen combien haïtien te vraiment affecté. Comment haïtien qui vraiment tal contest là, combien haïtien qui vraiment tal l'hôpital, combien haïtien le yo te rive l'hôpital was in critical condition. Information ça c'est très important pour nous gagner.
Vous pensez que si vous avez incentives, parce que, hey, on nous dit ça, depuis qu'il y a un bagage pour récompenser pour faire un bagage, vous pensez que si vous avez dit, la population haïtienne n'a tel incentive n'a pas nous, pour nous non seulement tester, mais mettre non, alors mettre groupe ethnique, nous côté nous sortir, est-ce que vous pensez que ça t'a capable d'aider? Quel que soit l'incentive là.
Whatever it is, yes, I do think, you know, incentives does help in anything that you're doing. I can give you an example. Right now, I am part of Mefepati Young Grant. It's called Keeping the Faith Grant, an opening of churches. And it's a grant that was allocated for the Liberty City, Little Haiti, and the North Miami area for the small churches that don't have the money to buy the thermometers, to acheter the hand sanitizers, to acheter the cleaning products that they need. So that's an incentive, and also to encourager the leaders of the church to get tested for COVID, and their members that's going to be involved in the church to get tested for COVID, so that you know that if I'm opening my church, I'm not bringing in some people that are COVID positive. And I'm sure.
Say Hannah, right? Say Hannah.
Yeah, and Hannah, what Hannah's role? We are part of the grant, and Hannah's role in the grant will be to provide the Creole information, the Creole education, along with other organizations, the coalition, the faith-based, the Haitian American faith-based network, and different aspects. And this is not just a particular church. We have Seven Days Adventist Church, we have Evangelistic Church, we have Church of God, we have Baptist Church, we even have a Catholic Church that's also part of this reopening, Keeping the Faith grant and reopening. We even have the Nation of Islam and their temples who are also participating in this. So to say what are we doing, what type of incentives? Unfortunately, fortunately, there are incentives out there. Unfortunately, we just don't know how to go about getting these things together. So when we got invited to participate in this grant, we're like, great. The churches want to be open. Some of them are afraid to reopen. And you see the stories about churches that reopen and then they shut down because people were tested positive for COVID or became sick with COVID, because your pat will report you the right way with the proper education and the proper equipment and the proper precautions in place. Yeah. But I do agree that incentives does help.
Comment initiative ça, comment vous te recevoir? Est-ce que tu as une résistance ou du moins est-ce que nous commençons déjà? Comment ça marche pour nous? Est-ce que vous collaborez ou bien vous avez une résistance sur ça? Encore, en parlant du gouvernement, vous avez dit, bon, c'est le gouvernement qui a dit nous, etc., qui a fait une test, qui a fait des scénarios. Est-ce que nous avons une résistance ou bien nous collaborons?
Actually, no. Nous pas une résistance. Nous avons une l'église that welcomes the program, and the grant was only for 30 churches, and we're over that capacity. And nous avons l'église qui toujours a demandé est-ce qu'elle a toujours participé là-dedans. So it's Robert. I'm sorry, I can't remember the name of the foundation right now, but it also with the Black Physicians of South Florida is leading the grant. We haven't gotten resistance, and which is good, which is awesome. The pastors, they're welcoming it. You're content. Et que yo joignent, même si li pas tant pour c'est gros l'argent, but at least c'est yon bagay qui ka aider yo pour yo ouvrir porte là pour yo recevoir et fidèle.
Well, contrôler nous, etc.
And actually, moi-même te contacté de toi à l'église, là me contacté yo gen pile nan pasteur yo te dit pa konnen qui moun sa yo ye kote yo sorti, est-ce que c'est vrai? So what we did is we provide them avec passion grant là pour yo ka wè, and you provide them avec liste l'église yo pour yo ka wè, c'est pas ou seulement mais l'autre l'église qui involve, and yo te fait réunion avec tout pasteur moun qui en charge grant là, et fait réunion avec toutes les pasteurs yo qui voulaient participer pour montrer yo mais comment on a fait, mais information que on a ba ou mais ça que on a recevoir. So après ça they feel like, oh okay, thank you for including me, merci parce qu'on invité nous et nous apprécier ça et yo content.
That's great. That's wonderful. That's wonderful. Autrement, n'a perdu grant là, nous pas utiliser pour communauté noire.
Exactly, c'est ça qui fait. C'est une bagay qui en pile grant qui toujours dehors, mais nous même dans la communauté haïtienne, nous pas jamais recevoir because nous toujours résister, nous toujours peur that there's something attached to it. So the grant was there. En premièrement, yo t'a fait dans la communauté payo. So nous dit non. Et toute l'église haïtienne qui dans la communauté à tout. Yo fait partie communauté dans Little Haiti, dans Liberty City, dans North Miami. Il y a un pile l'église dans zone ça yo tout. Mais c'est pour zone ça que grant là nous pas juste quitter notre communauté américaine noire, faut nous venir avec notre communauté haïtienne tout. Et then c'est une bagay tout, une bagay qui très important. Des fois il y a incentive yo là, but because resistance nous-mêmes nous toujours peur, nous toujours penser que there's something attached to it, nous pas participer là-dedans.
Et si l'église ou bien leader, l'église capitaine de Kounye, un pasteur qui pas comme ça et qui t'a besoin, je m'excuse, qui t'a besoin plus d'informations sur ça, si vous t'a intéressé, qui est-ce que vous avez?
Mwen pa konen si ap toujou, if they're taking in any more church, si al gen l'Eglise ki ap resevoa, but si yo vle kontakte, yo ka kontakte Hannah, mwen ka pataje informasyon avek moun ki responsable grant lan. Numéro téléphone Hannah is 305-609 74 98. That's 305 is 305-609 7498.
Okay, great. Okay. All right, mettez sur écran pour capable voir ça. Et même quand on wrap up, on a fini. Et est-ce que vous avez un dernier, sinon comment pour nous être capable de supporter Hannah pour bel travail ça que la fait depuis 1984. Ça fait 36 ans. Comment nous être capable de supporter Hannah?
Well, Anna toujours à travail, même si nous COVID que nous toujours à travail. En premièrement, yon nan bagay si infirmière ka poutem dehors, sou pa fait partie Hannah. If you're not a member of Hannah, please join Hannah. The work travail la en pile. Et yo dou ke nou nan communauté haïtienne nou ti en pile men chay pa lou. So, nous besoin infirmière, nous besoin membres pour faire partie Hannah, pour aider nous avec le travail là.
Est-ce que faut payer pour entrer pour joindre membership Hannah?
Yes. Hannah membership, vous payez once a year, une fois dans l'année, $125 seulement. En puis l'autre organisation de professional, c'est $300, $400, nous même là, $125. You fill out the application, you can go online. A website Hannah, c'est www.hannah, HANA, you capable partager. Et si on monte tout à remet faire une donation pour aider nous continuer le travail là, because nous pas juste travailler dans la communauté, nous travaillons à Haïti qu'on y a là et nous actually nos process que pour acheter 1000 masques pour nous voyer élèves infirmiers Haïti avec association infirmière Haïti a demandé nous si nous capables aider avec masque pour yo bay infirmière qui travaille dans l'hôpital Haïti. So c'est une bail nous même Hannah gants avec gowns pour aider. So n'a travail pour nous comment nous get that process going to get 1,000 masks to the nursing school, 1,000 masks, gowns, and gloves to the nursing association in Haiti for nurse. So, vous avez fait une donation et nothing is too small. Pas gagner qui trop petit, mettez $5, nous apprécions. Si vous voulez faire $1,000 donation, même nous apprécions tout. So, vous voulez buy ou aller dans le website là, www.hannahoflorida.org, et nous cliquons on donation, nous faire une petite donation, nous comptons, et Mom Hannah, and élève tout, si vous avez élève, infirmière, nursing students, you can be a part of it, et nous dit, ou pas besoin haïtien, so if you're a non-Haitian, you want to be a part of Hannah, you can join Hannah, you can become a member as well. You don't have to be Haitian descended to be a member of our association. That's nursing student, nurses, whatever level, LPN, RN, APRN, nurse practitioner, doctors, PhD, whatever level you are, we welcome you in the association. Et nous demandons pour la communauté pour continuer à prier pour nous, continuer à supporter nous, partager informations, les nous banons. C'est comme ça, vous êtes capable d'aider, vous voulez faire une donation, vous carrez et nous parler avec, et nous avons plus d'informations, 305-509 et 74-98. Thank you.
509?
It's 609. 305-609-7498.
Okay, yes, we did put that up there already. Okay, very good. Et nous dit que CNA ou bien LPN ou bien capable de faire partie de l'organisation ou bien just nurses?
Well, you have to be a license. You have to be a license. And no one see CNA ou bien PCT à living volunteer avec Hannah. We welcome them too. You know, like right now, we're waiting to hear because we're going to go cyclone Texas avec Louisiana. And Hannah, we provide disaster relief, we provide aid to disaster pay. Nous te fait mission, let te gen cyclone année passée dans Bahamas, en Natale, nous te porté aid for
Yes.
the people in the Bahamas. So we do that too. So nous attendons pour nous tendre qui ça cap développer, and then si Hannah capable aider. So nous toujours besoin aide, nous toujours besoin membres, nous toujours besoin volunteer, nous toujours besoin donation sponsors. Who will sponsor an event that we're having, a meeting, we always welcome it. Yes.
Wow, that's wonderful. I know of a first lady, on m'a pasteur vraiment vrai avec toute ton équipe qui t'a aidé l'année passée, le Bahamas.
Oui.
Donc, c'est bon. Donc, bon travail, bonne continuité. Et Jean Mandé, on a toujours continué, Kembe, on a pensé nous dans la prière. Et tous viewers, yo, allez dans www.hannah, H-A-N-A, of Florida.org. Jean, Madame Présidente l'a dit, no donation is too small. Si c'est $5 gagnant, la gueule non organisation non association haïtienne. Si c'est $10 gagnant, la gueule non organisation haïtienne non pour yo capable prospérer, yo gain durabilité dans la communauté parce que là depuis 36 ans. Et ils se sont prouvés, ils ont fait preuve d'endurance, de durabilité, de bon travail. Donc encore, Madame la Présidente, un grand merci. Quelle que soit l'heure, il y a une belle information, il y a une bonne information pensée, ou qu'on n'est pas plutôt pensé, ou qu'on est qui est capable d'aider just, you know what, ring me, Pastor Sarah Bachoni, messenger me, email me. You have my number, and then just say, come on. I'll look at my calendar and I say, okay, all right then. Any information that you deem appropriate and very important to our community, you're welcome on this platform to share.
Thank you.
All right, and God bless you. Thank you so very much. Yes.
Thank you. God bless you too. Thank you to the Facebook viewers. Tout le monde
yes,
qui
Facebook.
Merci.
Merci beaucoup. Et succès, bon succès. Donc, c'est là que Thursday Night Live prend fin à soir. Encore, nous disons grand merci de ce que vous êtes avec nous. Songez que tâchou, c'est pour partager live là, c'est pour activer. Bah ouais, quand il y a une question, ça veut dire nous laguer. Pour me poser question, but that's okay. That's all right. So, partager live là, moi, quoi, dans une fondation solide, une fondation spirituelle solide. Nous là pour nous partager l'évangile, pas seulement l'évangile, mais à niveau social, dans tout niveau pratique là, nous là pour nous faire une différence dans la communauté. Moi crois dans vocation, moi crois dans appel, moi crois dans service. Donc c'est ça que fait, c'est pas que je pas rien pour me faire, c'est pas que je pas fatigué bon avec COVID-19 ça là. Vous comprenez petit monde commencer l'école online, travailler la caille, ou occuper caille, faire manger etc. Bagay tête chargée net. Mais je crois que gagne un plus grand appel, un bagay qui plus grand, un plan qui plus grand, OK, c'est prendre soin peuple bon Dieu dans tout sens et c'est ça plateforme ça là pour le faire. Que bon Dieu bénisse nous. I hope le mal garder ma voix que nous te partager. OK, pas partager une seule fois. M'a regarder des live mes amis, pas dans tripotage, pas dans un, mais m'a regarder des live. Live la gagné il était gagné 200 moun, il y a 300 partages. I was like, oh, comment faire gagner 200 moun et puis il y a 300 partages? Ça veut dire moun yo keep on sharing. Ça veut dire que on seul monde n'a doit partager 3 fois, il doit partager 4 fois, il doit partager 5 fois. Sous un groupe haïtien, la gueule groupe haïtien yo. OK, donc bon Dieu bénisse nous, que bon Dieu fortifie nous, que bon Dieu reste avec nous. Pas oublier nous ensemble vendredi matin. OK, lundi matin, mercredi matin, nous avons une belle étude que nous avons fait, son bagage extraordinaire, encouragé. Et si vous ne pouvez pas lever à 6 h du matin, that's okay. Go back on YouTube and watch the sessions, the Bible study sessions. What béni, what encouragé. For the English viewers who were there with me yesterday morning, mercredi prochain, nous allons poser des questions à mini Jeopardy, so get ready. OK, review your notes. And pour Creole viewers, nous te fait leçon en lundi, demain matin nous allons faire un petit test tout. OK, que mon Dieu bénisse nous, que l'Éternel te bénisse et qu'il te garde, que l'Éternel fasse luire sa face sur toi, qu'il t'accorde sa paix, que l'Éternel tourne sa face sur toi, qu'il t'accorde sa grâce au nom de Jésus. Et c'était la Thursday Night Live. Bonne nuit avec le Seigneur. Que le Seigneur vous bénisse. I love you. God bless you. Bye.